Bringing hope the world over. Hope Channel.
What if we said we could add 10 years to your life?
What if we said you could reverse your disease? Would you believe us?
Here's a fact. Diabetes does not only reduce the lifespan by 5 to 10 years, and it does not only cause 100,000 amputations each year, it is the major cause also of renal failure and blindness.
But here's a secret. You don't have to be like them. We offer you no scary injections, no insulin, no radical treatments. Just plain, simple, practical advice guaranteed to add not just years to your life, but life to your years. I'm Weanne.
And I'm Mark. And once again, we would like to invite everyone to enjoy another episode of
Longevity Secrets. You know, today we will be talking about diabetes, a subject that is close to my heart because a lot of my relatives have this disease and I'm scared that I might get it also.
Yes, I've heard it's hereditary or
Yes.
it's in the genes. Now, we have a story about a 52-year-old female by the name of Mrs. Ferrer. She is a diabetic for
How many years?
a long time.
Oh, okay.
And after going through the program of Dr. Blessy, for 3 months only, she managed to change her lifestyle into a total reversing of her disease.
So what did the program do to her? What kind of changes were made?
It was able to change her lifestyle into something that was much better, and she was able to reverse her disease just for 3 months. Now, they only added exercise, proper diet, okay, a positive attitude, and the right knowledge, and she was able to do this within 3 months.
So let me get this straight. There was no insulin or other medications?
They did not give her a single pill for the 3 months. And the good thing about that is after 3 months, she was able to determine what foods would be good for her and what foods would really give her the disease and it would worsen her disease.
So you're saying that she suddenly made the right choices? She didn't eat meat anymore? She didn't...
She was able to tell whether the food was with meat or without meat just by tasting and without even knowing what was in the food.
Wow, so I guess that is a good basis of that we can say that she's truly on the road to recovery because she's making the right choices for herself. So to tell us more about this disease and how we can avoid it or prevent it is Dr. Blecenda Varona, nutrition and lifestyle consultant of the Need Health Ministries.
Thank you, Mark and Weanne. It's really right that when you have knowledge, you will experience healing. And it's really nice because many of our participants in the Need Health Ministries are now enjoying health and know soon that they are really expecting for longevity. You know what? This is another patient who is actually around 40 years old and he was actually an engineer. His blood sugar was close to 400 milligrams per deciliter. When he attended a seminar and started gathering all the knowledge, he started following a healthy lifestyle, you know, good diet and regular physical activity. And you can see big drop from close to 400. It is now, you know, 160 milligrams per deciliter. And that's really amazing without medication. You can see big drop from the fasting blood sugar. And right now, you know, this patient is a unique patient because he doesn't really want to take any medication. But you will really be amazed. After 1 year, you know, blood sugar is just very close to normal. It's 120, 115, 126 without medication and with good lifestyle. I personally believe this patient, this person, an engineer, very active civil engineer, is in the right track. You know what he's doing right now? He is, you know, they used to build bridges in the Philippines, and he keeps on parking far from the place so that he has the chance to complete his 10,000 steps per day. So that's the strategy. And the wife is also one of our very active participants. You know what? The wife keeps on cooking healthy diet. And not only that, the wife keeps on discovering more dishes for the husband. You know, the favorite of this husband is sinigang. And they have the healthy sinigang. You know, sinigang is just boiled with, you know, little of this sour thing. Maybe we can use, you know, tamarind or guava. And with all these vegetables, the wife can use the best vegetarian sinigang. And I personally believe that actually helps the blood sugar to go down. And he was able to learn how to eat unpolished rice and all these legumes. And he is now enjoying, you know, not only the diet and exercise, but, you know, proper sleep and water therapy and all these strategies in the secrets of longevity. And that is the best when it comes to healing, better than medication. Now, I'd like to congratulate really the husband and wife, and they are now achieving healthy lifestyle, not only for the sick person, for the sick husband, but healthy lifestyle for the whole family. Now, let's try to discuss diabetes. What is really diabetes? You know, the idea here is don't merely control your diabetes, get rid of it for good. And you really need to learn the strategy. Okay, the strategy here is refined foods plus fat makes you fat. So here is a very simple breakfast. This simple breakfast is common. But you know what? If you really look at this cannot give you health. You know, there is fat in the frying. You know, sometimes some people keep on eating 2 pieces of eggs for breakfast. And when you look at this, we can modify this into a healthy diet. Like, for example, try to look at the bread. Instead of using white bread, you can now shift to whole wheat bread. Instead of just putting the egg there, you can insert vegetables inside. Or some of you would say, okay, maybe I can just remove the egg yolk because cholesterol is in the egg yolk. Yeah, you can do it, and you know there's already modification. But sometimes you can also modify, you know, can have a bigger change. When I say bigger change, that means you have to remove the egg and then substitute another thing for that egg. We can teach you the scrambled tofu, and it tastes like real egg. Now, we have 1 episode in our cooking, Smart Cooking, and we will be sharing with you good cookeries on tofu, and it really looks like egg. Now, when you look at this kind of, you know, breakfast, for example, you know, you can even insert some vegetables inside, like you can put tomatoes and lettuce and all this. You know, the mayonnaise is not so healthy, not healthy really, and we can substitute that with healthy dressing. And how I wish that you can attend our Cooking Smart series so that you will be able to see how we can really make healthy dressing from, you know, from all these plant foods, 0 in cholesterol and 0 in fat. Now, what is really diabetes? Diabetes is a condition in which the body cannot use, cannot care, cannot conserve the food we eat, particularly sugar that comes from the food and body source, meaning there is mismanagement. Okay, there is mismanagement of food, of energy. Now, when you eat food, food becomes energy. And later on, food becomes blood sugar, and that is actually the unit of energy. You know, blood sugar can actually give us, no, that's the secret why we can move, why we can, you know, we can run, we can do things around. That is just like gasoline to your car or diesel to your truck. That is blood sugar. That is the unit of energy. So when you eat food, it becomes energy later on. Now let's try to see several kinds of sources. We have this table sugar. The table sugar actually is another source of energy, but it takes shortest time to digest. That's the reason why doctors don't allow you to eat or to drink foods that are really, or beverages that are really high in sugar, because it's just minutes and it becomes blood sugar immediately in your bloodstream. Another source of blood sugar is the starchy foods. Okay, the starchy foods, it takes a little longer time to digest and takes a little longer time to reach the blood. But you know what? A high fiber mixed diet takes the good timing, takes the longest time to digest and the longest time to reach the blood. You know what? It's so nice because if you have this high fiber diet, you could easily control your blood sugar. You know, the best idea here is when you go deeper, when I say big change, there are several kinds of changes. The small change, the medium change, and the biggest change, the big change. When you try to eat a plant-based diet, some people call it vegetarian, you could easily control your blood sugar, and that is actually the secret when it comes to reversing diabetes. So, a plant-based diet, and later on you would really come to understand that it's not just a plant-based diet, it is really a plant-based diet, and that can actually reverse. Many people keep on saying diabetes is not reversible. No, the good news for you today is it is really reversible. When we say reversible, it is reversible by healthy lifestyle change. Now, when I say healthy lifestyle change, it's not just a very simple change or a one-day change or a two-day change. It must really be a permanent lifestyle change. Now, let's try to see this idea. Here is a graph that would tell us, the right diet. You know, the blue band here, this is actually the post-meal, and the green band here, which is hyperglycemia. The hyperglycemia is high blood sugar level, and then the low blood sugar here is hypoglycemia. So this is typo error. This is hypoglycemia, very low blood sugar level, and this is high blood sugar level. What we would like to happen here is the blue band. The blue band is the ideal. Okay? So when you eat a very good diet, like, you have your fruits and vegetables, a high fiber diet with good amount of this balance, your blood sugar would go up like this when you eat a good breakfast, and then it would go down when you eat lunch. It would go up again, and it would go down. It would go up again when you eat dinner, and then you will sleep. Okay, now let's try to see here. With the blood sugar is your insulin. Insulin actually acts as door opener so that blood sugar could be used by the cell. So they are partners. They are just like, the lady with an escort. So the escort is the insulin. Without the escort, the lady can't get inside the room. So here is the blood sugar with the insulin, and you can now see here balance. You can now see here, smooth sailing supply of energy. Now, some people would say, I don't like to eat that healthy diet. I would rather eat unhealthy. Some of them are just drinking, they keep on drinking soft drinks in between meals or sweetened, sugary snack. And they miss the breakfast. They don't eat breakfast. So here is a snack, and blood sugar would go up like that. And then here, after 1 hour, blood sugar would go down. So you can now see a not so good scenario here. Just in 1 hour, the person might experience both hyperglycemia and hypoglycemia. That's not a good scenario. That's not a healthy feeling. Okay? And you can now see here, blood sugar is now coming down. Blood insulin still goes up. It is not really a good picture. Now, if this person is a diabetic, complications will really happen. But if this person is a child, a kid, you can't expect complications to happen, but you can see some behavioral change to the child. You can see, hyperactivity, and you can see, so poor concentration in school. And that's actually the reason why kids cannot really get a high grade because of the kind of diet. They don't eat their breakfast, and they have a very sugary snack in the middle of the day, and that can give the problem. Now, what we would like to happen here is we have to offer you in any kind of recommendation, you have good amount of fruits and vegetables in the diet. Good amount of fruits and vegetables. This is a regular food pyramid, and this can actually give us a good picture. You know, even the non-vegetarian food pyramid guide would recommend that diet with good amount of fruits and vegetable is really good. Now, some of you are not interested in the food pyramid or in the healthy guidelines. Many people keep on following a diet that can actually give sickness, and this is the kind of pyramid that they are doing. They are following. They eat large amount of fats and oils and sweets. You know, they don't eat vegetables and fruits, and they don't eat, good amount of fiber. You know, this kind of pyramid, actually I copied this in one of the researches published in the American Journal of Dietetics, studied by Dr. John in early 1980s. You know what? This is this picture of the food pyramid guide being shown in the television for kids. You know, if your kids keep on watching television and there is psychographic effects in the advertisements, and they offer lots and lots of, food items in their show, and this kind of food pyramid is being, the kids are attracted, and this becomes their choice. And the choice actually is so frightening. You can see high fat here. The kids don't like to eat fruits and vegetables, especially those kids who are really watching long hours TV show. They don't want to eat vegetables and fruits. They don't want to eat good. They want only high fat and high sugar and high salt. And what will happen to the next generation? Okay. Now, here is the picture of a normal person, normal condition, and here is how insulin plays its very important role. Insulin acts as a door opener so that blood sugar can get inside the cell. By the way, I have mentioned in our previous episodes that our body is composed of around 75 trillion cells. All throughout our body, it's 75 trillion. It's really huge. If you're not so sure of the figure, you go Google and you can see 75 trillion. How really big is 75 trillion? You have to feed these cells. Okay, with the right kind of food. And you have really to control your blood sugar. You need to control your blood sugar. Now here is a slide. The bloodstream here is just like, a highway. And here is the insulin. Insulin acts as the door opener so that blood sugar could get inside the cell. Energy happens here. That is the factory of your strength. So you really need to try your best to eat right so that you can feed well the cell. Okay, this is a normal condition. Now, if this person goes to the laboratory and have his blood tested, and the medtech would get a sample of blood somewhere here, and then count the number of blood sugar, this would really give you a good picture because the person here has normal blood sugar level. Okay? But here's another picture. Here is the type 1 diabetes mellitus or insulin-dependent diabetes mellitus. Here in the picture, there is no or too little insulin. So you can see here, there is no door opener. So when you look at the bloodstream, it is really loaded with blood sugar. So when this person goes to the laboratory and have his blood tested and then get some sample of blood somewhere here, obviously, blood sugar is too high because, it's just in the bloodstream. It can't get inside the cell. So it's hard to really, protect this person from complications. Complications is so high with this kind of blood sugar. So here, because there is no insulin, you really need to inject. What I mean is you really need injection here. External insulin so that, you can help the condition, the scenario here. Here's another condition. This is type 2 diabetes, non-insulin diabetes mellitus. And if you can see here, pancreas produces some insulin but not enough. So you can see here insulin but not enough. So again, when you go to the laboratory and have your blood tested and get sample of blood here, you can see that there is too much insulin in the bloodstream. Okay. Here's another picture. The picture here is type 2B. Pancreas produces enough insulin. However, the cell receptors are made inefficient by excess fat. You can see here, there is sufficient insulin, but, you know, the cell is covered with fat. So, the first strategy that we should do here is to reduce the fat. Reduce the fat level of this person. Here, when you get a sample of blood somewhere here, obviously, you can see high blood sugar level. So again, diet can actually help in these conditions. When they eat less taxing diet and lose weight, they don't need extra insulin to control their blood sugar. So they need to know the diet that is really best for this condition. No diabetic patients on medication should make dietary changes without the assistance of a physician, as adjusting the medication will be necessary to prevent hypoglycemia. So it is so important to go to the doctor so that the doctor would adjust your medication. And I would like really to salute to the medical doctors, especially those of you doctors who really trust lifestyle, can help your patient. I would like really to congratulate you because you are the best doctors for these diabetic patients. Now, it must really be a good relationship between the doctor and the dietitian. And I'm asking also the dietitians listening to us right now, you really need to venture on healthy lifestyle because your strategy can actually heal these people. Okay, so it's good partnership, support group with the doctor and the dietitian, of course, with the patient and with the whole member, okay, the whole members of the family. Okay, so the simple advice here is, you know, you have to limit or you have to avoid refined starches such as white rice and white bread and pasta. You know, as much as possible, we encourage you to cook unpolished rice. It's so easy to cook unpolished rice, and it's so practical. We can also avoid sweet foods. Now, avoid ice cream and cakes and chocolates, sweetened desserts and soft drinks and beer, and all these sweetened desserts and sweetened snacks. You have also to, as much as possible, you know, if you can just limit or you can control your preserved fruits and eat only fresh fruits. Okay, you have to avoid all fatty foods, and raw nuts are a good source of fat. You have to name the diet. Actually, according to Dr. Joel Furman, I like his diet, Eat to Live, and he said in the diet, the best diet for diabetes is greens and beans. Now, I have to try greens and beans, and that's so simple. Those of you listening to me, health educators, so simple advice, and even laymen can understand this. Eat greens and beans, and you're sure that you're giving health and healing to your sick people. You know, green vegetables and beans should really make up the most of the diet. Limit animal products to no more than 2 servings of fish weekly. If you do that, you will be able to achieve the goal. It's best if you can remove all and substitute with the greens and the beans. You know, the beans, if you can just eat 2 servings of beans for the whole day, you can actually experiment on this. Okay, so try to exercise regularly and consistently, like dispensing your medication. I would like to offer here change. When I say change, you have small change. And if you just follow a small change, you'll have a small benefit. If you have big change, you have big benefit. So here is an idea that can actually offer you the bigger benefit. If you have your exercise, you have your good diet, and obviously you could easily control your blood sugar. Now here's a patient who came to me, and he was actually diabetic. You know, on the first day that he came, the blood sugar actually was close to 170. But later on, when we started the diet, and on the 5th day, we have discovered that the blood sugar was actually close to normal, and we asked the doctor to remove the medication. So on the 5th day, we called the doctor, and then the doctor agreed with us to remove his, his diabetes medication. And on the 6th day, you can see the blood sugar, the drop in blood sugar. You know, this figure continues until the 7th month and up to the present. You know, what I'd like to show you here is a lifestyle with medication, a bad lifestyle with medication. But here, lifestyle, a good lifestyle without medication. So this is your choice. You know, your lifestyle actually is so powerful. The diet is so powerful than medication. All you have to do is discover the right diet. You know, this patient also has heart problem, and he had severe chest pain, but later on the 2nd month, we saw that there was already healing. And here is the patient, diabetic patient before he came to the program. He was so constipated, but you know what? On that week, he was able to experience good bowel movement, and this is really wonderful. You know, you can now see the 18 hours, releasing of all these toxic substances. And then this patient had experienced good angiogram on the 2nd month. You can now see improvement of the diet. You know, not only for diabetes, but it can also provide good health to the vascular health. You know, the intake, by the way, this patient, we weren't able to put on pure vegetarian because, he can't eat without fish. But this patient really loves vegetables. So what we did is, we still continue giving the patient with little fish, but as much as possible, the amount of fish is just like this, small. And we loaded that with all the vegetables and all talbos ng kamote and all these leaf greens and, all this malunggay and as much as possible indigenous vegetables. And we experienced we saw the healing in this person. It's not only diet, we incorporated with good lifestyle, exercise, 10,000 steps per day. And on the 3rd month, he had severe chest pain. But on the 3rd month, he called me up while he was in the hospital. He was on the ground floor of the hospital, and he told me, "Blessy, can I climb to my doctor?" And he's up there on the 3rd floor. And then I told him, "No, sir, use the elevator." No, do not worry. I'm okay. And anyway, I'm here in the hospital. I'll just try if I can climb from the ground floor to the 3rd floor. It's so amazing. When he reached the 3rd floor, he tried to get his blood sugar and tested, that the doctor tested him, and there was no chest pain. But before he started the program, he can't even walk from here to there. It was already severe chest pain. Now, healing is possible, my friends, if you just have the best lifestyle. It's so possible that with a good lifestyle, you will be able to protect your whole body. It's not just diabetes. It is not just heart disease. It is not just cancer. It is almost all chronic diseases, my friends. And I'm so happy to tell you that when you prevent diseases, you are now entering into longevity secrets.
Thank you, Dr. Varona. Thank you for giving us and our viewers the confidence that though we may be genetically predisposed to this disease, we can avoid it just by making the right choices and the right lifestyle changes.
Truly, knowledge is power. Without power, we won't be able to make the right choices that would enable us to get rid of the worst disease of all, which is ignorance.
But always remember that knowledge is not enough.
Yes.
We must apply the secrets of proper nutrition, exercise, water, sunlight, temperance, fresh air, rest, and a sincere trust in God in our everyday lives. But don't just stop there.
Let us share these secrets to the people around us so that they would know that there is healing here. Once again, I am Mark.
And I am Weanne, inviting you to join us on the next episode of
Longevity Secrets.
Bringing hope the world over. Hope Channel.